As of an hour and 25 minutes ago, BMA consultants working in the NHS have gone out on strike. That means only basically barest level of a Christmas Day cover is available. Tomorrow, they'll be joined by junior doctors. And for the rest of the week, junior doctors will be on strike while the consultants go back to work. But it does mean yet more hundreds of thousands of appointments being cancelled. We've seen again and again this, while 7.7 million people, 1 in 7 people in this country, languish on an NHS waiting list, some for very, very serious treatment and surgery. But the government are saying they're looking at extending the anti-strike laws they brought in July to affect emergency services like ambulances and fire and rescue and railway workers. And they're talking about consulting on extending that to healthcare workers, those in emergency and urgent care being required to work, and also time-critical health services like, for instance, cancer treatment that does often get cancelled on strike days. Well, let's talk about this with Dr. Tony O'Sullivan. He's co-chair of Keep Our NHS Public. Good morning to you, Tony.
Good morning again.
Thank you very much indeed for joining us. Just first up, in terms of the possibility of extending these anti-strike laws, do you agree with the government? Should there be a minimum level of service for some of these key areas of care on strike days?
Well, there are two things I would say. One is, I think this is a real deflection by the government from their responsibilities in this case. There's a right to strike of health workers, and that has to be maintained. The government has a duty to negotiate, and they've failed to do that. And safety measures are already in place. They may be minimum safety levels, but they are there. They were there from nurses, from ambulance staff, from radiographers, and from doctors as well. The second thing is that we really should be asking, rather than facing this government kind of diversion from what's going on, why is this dispute still going on, and how is it going to be resolved?
Well, yeah, we do want it to get to be resolved, certainly. I mean, it's bizarrely, it's more than 100 days since the BMA representatives and the Health Department have actually met for talks. So they haven't met since May, which is extraordinary. But why do you say it's defection? This is part of the key issue, isn't it? Look, I believe in the right of people to join a union and the right to strike for collective pay bargaining. That's the reason why we've actually got a lot of the rights that we just take for granted, to have days off, holiday leave, maternity leave, sick pay. These things weren't given to us out of the goodness of employers' hearts. They were hard-won battles. However, there are a lot of people who will be saying, look, if you choose to work in something as important as healthcare, and the same as we've got, for police and soldiers and the like, and now under the new law, ambulance staff, fire and rescue, and railway workers, when you perform such a critical service that so many people are reliant, people haven't got the option of going. Supermarkets, in Morrison's, the supermarket workers are on strike. You can't go, well, I'll go to Sainsbury's instead. That's an option, but it's not an option when you need NHS healthcare. That actually we do have a need to have, minimum levels of care, not just if you've had a heart attack and you arrive in hospital, someone will treat you, but yes, your urgent cancer treatment will go ahead.
Well, I think the responsibility for this is a shared one, and it's shared between the workforce and the management. And in this case, the management is, in line terms, is the government ultimately. The safety measures are already there, and they have been negotiated in great depth, for example, by the nurses and right through to today. And I think why I'm saying it's a diversion is that it's a deflection by the government from their responsibility. Now, if you pardon the analogy, I think what's going on over the last period of time in the NHS is a bit like an abusive relationship. And in that case, you have to ask who holds the power and who is responsible for resolving the problem. The people that are in power are the political leaders and the government over the last 13 years now. The state of the NHS and social care is absolutely, totally unacceptable. And I think you agree that from previous conversations, that there's avoidable deaths in there.
I think a lot of that's down to NHS management rather than the government, though.
No, it's not.
No, I mean, I don't think there's any evidence that NHS management is any good. I mean, given that they just decided to spend, we're going to hire millions on another 244 people to work in diversity and equality, as opposed to they haven't got any money to hire a radiographer or a surgeon, but they've got the money for that. Come on.
Well, I've said this before. I know very well you're well informed. You're a leading presenter on television, you know very well that the NHS is so underfunded.
It's not underfunded.
That it has become
the NHS is not underfunded. It's not underfunded compared to other healthcare services in the world. It was underfunded for a number of years under austerity. I'm sorry, it's just the money is spent on the wrong things. It's an inefficient service.
Who do you believe? I mean, don't you believe people like the King's Fund, the Nuffield Foundation, the Health Foundation? Don't you actually?
No, we haven't. No, we haven't got enough doctors. We haven't got enough doctors, nurses, or beds. But that's not to mean it's underfunded. We spend the money, we just don't spend the money on the right things.
How come there are 100,000 vacancies? How come we have fewer scanners?
Because we're not paying the money for the right things. But we can hire. How come there aren't vacancies for equality and diversity officers who are paid more than the doctor who's operating on your child?
Well, if you talk about spending the money on the right things, you know as well as I do that there's a real scandal during COVID, the diversion of money to the private sector rather than using the resources of the NHS and the universities.
That wasn't. No, the scandal was we bought up private healthcare, every single bed in the country, and then didn't use them. That's the scandal.
If you are running a service and you don't have enough money to pay to employ the right staff, and if your government has actually failed to have any kind of workforce strategy for the entire.
The NHS management failed to have a workforce strategy. They could have brought what they could have presented one publicly and gone, well, this is what we want. They didn't even have one.
Well, I think we've had this discussion before, and you blame management, and I blame the government. I don't say that. Who are you
going to blame? I'm going to make a guess at your politics, Tony. Who are you going to blame if and when Labour, as the polls predict, are in charge, and if after 5 years of Labour in charge, the NHS is still a complete basket case, and we've still got millions of people on waiting lists, and they spent millions more? Who are you going to blame them?
I'm going to blame the government in power, obviously, Julia. I would expect from any opposition that comes in, any new party that comes in, I would expect of them a commitment to fund the NHS, at least on the par with France or Germany. I would expect them to commit to respecting public servants for the services that they give and honour them to have a proper pay package. I would
proper pay package? I mean, the junior doctors have been offered 8.8% and consultants 6%. That's more than most people in this country have got in the last year.
Inflation this year is at least 7%. The retail price index is 10%. So that's for this 1 year, that's pay stasis rather than pay improvement.
I know, that's what a lot of people have had to deal with,
And the impact on the NHS is serious, and you know that. There's a hemorrhaging of staff away, not just doctors, but nurses. Last year, 40,000 nurses left the NHS. So the situation is one of disrepair. It's also a neglect of social care, so the whole system is blocked up. There's an unacceptable treatment of staff in the health and care sector, and the way forward is negotiation, Julian. They've done it in Scotland. The doctors settled in Scotland. So why doesn't this government come to the table?
All right. Well, look, really appreciate that. Great to talk to you, Dr. Tony O'Sullivan, from co-chair of Keep Our NHS Public.